Good morning. Welcome to Ask Dr. Murphy This Week in Public Health. I hope everyone is doing well today. My name is Katie Berg. I'm a research study coordinator with the Havey Institute, and I'd like to welcome and introduce Dr. Robert Murphy. Dr. Murphy, how are you this morning?
Doing quite well. Thank you, Katie.
Dr. Robert Murphy is the executive director of the Havey Institute for Global Health and the John Philip Bair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine. Today, Dr. Murphy will be addressing the latest headlines and answering a viewer-submitted question through today, May 22nd. We invite any questions or comments down below or via any of our social media linked in the description. Starting with the big news this week, there's an Ebola outbreak that has been declared a global health emergency. Dr. Murphy, please bring us all you can.
This is a ongoing, growing epidemic. The 17th epidemic of Ebola virus since Ebola virus was discovered. It's the third biggest of all of them, and the 17th. It's a new strain, the Bugyo strain. It's such a new strain that the original tests that were used did not work. There's no vaccine or treatment for this. There is a vaccine for one of the older strains that was identified in the epidemic from 2014. People may remember that killed 11,000 people. So right now, and the numbers are changing by the hour, by the way, there's at least 750 people in the Democratic Republic of the Congo, Uganda, and South Sudan. They're all neighboring countries. There's at least 175 deaths, and these are growing. It's mostly in the rural areas, but actually two cases have been identified in the city of Kampala. That's the capital, the large city of Uganda. And it went for almost an entire month before it was identified as Ebola. That's how bad this was, and that's why it's so out of control. In the past, most of these other 16 other epidemics have been controlled pretty quickly. The Congo people have been trained in this, trained originally primarily by CDC and USAID funded programs, which no longer exist. Now, WHO is very much involved, and they send people down to work with these ministries of health. So, but the overall response is surprisingly slow, and the thing has gotten out of control. So that's where we are. It's got a high death rate. It's spreading. And then what's happened now is they've invoked Article 41, I think it's called. So people who have been in those countries in the last either 3 or 4 weeks cannot enter the United States. The border is closed to them. There was a person on an Air France plane going to Detroit from Congo, and Air France knew the rule that this couldn't happen. They didn't figure it out till the plane was en route, and they made it divert to Montreal. The person is not sick. There's not a health emergency, but the patient falls under this category. Now, anybody coming from those countries, US citizens or residents, they all have to funnel through Dulles Airport. And there's a special health group there that's evaluating them. During the last epidemic, the 2014 one, which actually I was involved in. I was the administrative director of a lab that was actually testing for Ebola. I didn't work in the field or anything like that. But the last one, people who had been in those countries had one of 5 airports they could go through, including Chicago O'Hare. But anyway, this is the story now. So that's what's going on. And it's an evolving story, and will hopefully now, with the resources going into place in those 3 countries, we can get this thing under control.
Absolutely. And as Dr. Murphy mentioned, these numbers are changing by the hour. We just got a WHO update with these most recent batch of numbers that could increase by the end of the day. We just don't know yet.
Yeah, I
Scary
mean,
stuff.
and the feeling on the ground there is that this is grossly underreported.
Wow. So
Okay.
we definitely will be keeping our eyes on the story as it develops. But we do have a great submitted question today. So transitioning into that, we have a viewer who asks, can Dr. Murphy explain whether there is evidence that getting the Shingrix vaccine may reduce the risk for dementia?
Yeah, this we reported on this a couple weeks ago, and this is not the only study that has shown this. Now it's like I think three large studies. So this is a US study published in the journal Alzheimer's and Dementia. Okay. And they looked at an analysis of 1.5 million people in Medicare, in the Medicare program, who received the Shingrix vaccine. And if they had both, there's a two-dose Shingrix program there. So you have to take your first dose and wait a couple months and take the second dose. So anyway, they looked at them and they found just interesting in the 3 years following the administration of the vaccine that there was a 33% decrease in the amount of dementia between vaccinated Medicare recipients and unvaccinated recipients. That's a large number of patients. And so that's the power. Two other studies have shown the exact same thing, international studies with very large numbers of patients. Um, so this is really surprising. Now we know that the Shingrix vaccine, which prevents shingles, which is reactivated herpes zoster or varicella zoster, which is the virus that causes chickenpox, which stays in the nerve that goes into the brain, so it's like it is related. But it's really it's a very dramatic difference I mean, what works 130% of the time. Now, the problem is it's not a randomized study. It's what they call an observational study, but it's quite an observation, and two other groups have shown the same thing. So it should be taken very seriously because dementia is just a horrible disease, and it needs, of course, further study. But this is an approved vaccine for a horrible disease. People that have had shingles can tell you how horrible it is. It can be on the face, the back, anywhere. And I mean, that's bad enough, let alone to have this benefit. So, the new rules, talk to your doctor. Well, I hope your doctor has read this report and decide whether you should take it. And you should take it anyway. But if you're worried about dementia, you definitely take it. So it's an important study and it's quite dramatic.
Absolutely. And as more information comes out about this subject, we will, of course, look into it. Like Dr. Murphy said, we found a study recently published that was about cardiac effects as well that were
Right.
beneficial from this vaccine. So lots of great things.
Yeah. It's the inflammation from the eruption of the varicella that, is probably causing all these other problems, neurologic and cardiac. So if you don't have that eruption, you don't have that adverse effect. So
Sounds like a good thing to
tied
me.
together.
Yep. Now, we do have other big news on the Hantavirus outbreak, which has not grown a lot, but it's good to still keep our eyes on it. Can you tell us the most recent news?
Well, the big news is there's still, this is now like a month into it, 11 people with confirmed or absent, really highly suspected disease and 3 deaths. There's no change in that number. So that's really good news. None of those people that were exposed on the airplane or whatever like that, nobody else has come down with the disease. So this is like really a good sign. Now there's a total of 41 people in the United States that are in some kind of isolation or quarantine. 18 of them are in these like facilities we have in Nebraska, and two are in Atlanta at Emory University. and everyone doing okay. And then there's a total, so there's like 23 other people who got into the country before they realized what was going on, and they're being monitored by their state health departments. None of these people has gotten sick or had to go to the hospital. So that's kind of the status of these people. Now, one of the interesting twists is that, and they must be getting tested like daily or something. Who knows what they're doing? They're not really talking, but they're being monitored very closely, especially those ones in Nebraska and Atlanta. And two of the ones in Nebraska want to go home and get monitored by their home health department. These were all people on a luxury cruise. They paid a lot of money to go on that luxury cruise and see wild nature. So these are people with some resources and stuff. And it's interesting. Two of them want to go home, and they don't have any symptoms. Their tests must be negative, and they're not letting them go. So they wanted to go, and they said, if you leave, like I don't know what they're gonna do, call the police or something and bring them back. So this is being supported by the director of the CDC, who was one of the huge proponents of not of people with to be able to do whatever they want to do around the COVID pandemic. No masking, no quarantining, no nothing, no vaccine mandates. He was a big proponent of all that stuff. And so he's the one doing this. And so he was asked, like, hey, look, during COVID, you had all these, you didn't want to have all these restrictions, and now you have the restrictions. He goes, well, it's coming from higher up. So higher up from the director of the CDC, and he's also the director of the NIH. So, who's telling him what to do? It's like, he doesn't say who it is, but is it Robert Kennedy, who's an environmental lawyer? Is it President Trump? Is it Stephen Miller or one of these other experts in infectious diseases? We don't know. So anyway, but that's the craziness just continues.
It's a very interesting story. There's a lot going on there, and we will continue to follow it, of course. Our last story today is about a salmonella outbreak that's crossing a lot of states here in the US. Can you give us the most important information?
Yeah, so salmonella is a bacteria, it's been around forever. It's a big part of food poisoning, and chickens are notorious having it, any kind of poultry. And so backyard chickens and ducks apparently have a lot of this, and the number of cases now is up to 184, which have caused, you can get really sick with salmonella, 54 hospitalizations and one death from 31 states in the United States. And this all is linked back to 5 different hatcheries who have been supplying birds to retailers. So it's people in contact with these birds, okay, including ducks, Peking ducks in particular. So chickens and ducks, it's, they're trying to figure out, getting them out of the system. And uh, excuse me, and that's the story of the salmonella outbreak.
Hmm. I know backyard ducks and backyard birds are very cute. They're very fluffy, but
Yep.
please try to keep them away from your face and
Mhm.
wash your hands. But on
Yep.
that note, I'd like to thank you, Dr. Murphy, for your time and your expertise this week. It's much appreciated.
All right. Thank you. Have a good
And
week.
thank you all. Will do. And thank you all for joining us for Ask Dr. Murphy this week in public health. We'll see you next week.